Hi, good evening, everyone. This is Jennifer Falk. Welcome to MS Views and News. We are here tonight with MS Neuro TV, and we're just glad to see a lot of you logging on. So again, just to introduce myself, my name is Jennifer Falk. I am the Director of Development at MS Views and News. And for anyone who's joining us for the first time tonight, welcome. We do this every month, in the first week of the month. And every month we try to address an important and meaningful topic that can help people living with MS on their journey to wellness. Just to give you a little information about MS Views and News, we are a nonprofit organization dedicated to providing education and information to the multiple sclerosis community. And before we go any further, I'd also like to thank Novartis for their support of educational programs like this. Without our supporters, things like this aren't possible, so we give thanks and thank you to Novartis and to supporters like you who help us as well. And tonight we're going to be talking about integrative medicine, about nutrition, about wellness and movement, and we are very lucky to have Dr. Megan Weigel joining us tonight. And I'm going to give you guys a little background on Dr. Megan. Dr. Megan is a nurse practitioner specializing in neurological care in Jacksonville Beach, Florida, where she brings a unique integrative medicine and holistic nursing perspective to her practice at First Coast Integrative Medicine. She has been a multiple sclerosis certified nurse since 2005 and a nurse practitioner for 18 years. Dr. Megan is also a board certified advanced practice holistic nurse. So Dr. Megan is also the co-founder of OMS Yoga, a nonprofit organization that brings free yoga classes to people living with MS along the East Coast. She is a yogi, a surfer, a runner, avid reader, a writer, a mom, and a wife, and she enjoys her work in the neurology field immensely. So we are very glad and very lucky to have her here with us tonight. And as we move forward, we will begin with a pre-recorded interview with Dr. Megan, and we're going to cover some initial key points. So this pre-recorded interview should take about 10 minutes, and then we'll return with Dr. Megan live for your questions. You can start typing in your questions now in the question box that you should see on your screen. Just hit the little orange box and it should become available to you. And I have received a lot of your email questions, so those are already in queue, and I'm going to try to get to as many questions as possible. So if anything pops into your mind, I can see the questions, nobody else can, just feel free to write. No questions are silly, but we are going to try to keep the questions to topic tonight, which is integrative medicine, nutrition, and wellness and movement. So we welcome your questions. And just a quick note, if you are calling in and you're not logged in through a computer, just know that you will not be able to hear this pre-recorded interview. So you'll kind of have 10 minutes or 8 minutes of silence, unfortunately. But if you stay on the line, once we come back for Q&A, we'll all be together again and you can hear us again. So hopefully that works for everyone. And we're going to get the video started now.
Hi, good evening, everyone. My name is Jennifer Falk, and I'm with MS Views and News, and I'm here tonight with Dr. Megan Weigel. Welcome, Megan.
Thanks, Jennifer. Glad to be here.
Thanks for joining us at MS Neuro TV. We're going to talk about integrative medicine and a little bit about nutrition, wellness, and movement, and putting integrative medicine into the world of MS. Can you just explain to our audience exactly what integrative medicine is?
Absolutely. I think it's important because a lot of people come to me for care and they think that I've totally left the conventional medical world, and I haven't at all. And so integrative medicine is really the collaboration of conventional medicine and complementary and alternative medicine. And it takes into account the whole person, so physical issues, mental, emotional, spiritual issues, what you're going through, maybe financially and economically, socially with your job. So it takes into account all of those things. how they affect your health and well-being, and then uses an evidence-based approach to provide you with a treatment plan that may include conventional medicine, so medications, prescriptions, physical therapy, things like that, and then may also include things like nutritional recommendations, supplements, mindfulness recommendations, complementary and alternative providers like acupuncturists, Ayurvedic physicians, things like that.
I know we hear that a lot of people living with MS are taking their medicines, their disease-modifying therapies, but they often don't feel better. Yeah. There's still a lot of symptoms, and there's a lot of interest in integrative medicine. We hear the word or the abbreviation CAM, C-A-M. Can you just tell us what that is when we see that?
Yeah, absolutely. So complementary and alternative medicine are actually another two different things. So complementary medicine means that you're doing something alternative in addition to your conventional medical treatment that your physician provides, your Western medicine physician provides. Alternative medicine means you have decided to leave the recommendations of your healthcare provider completely to the wayside and follow something else alternative. And so I think a good example for that is, back really 20 plus years ago, bee sting therapy for MS was really popular as an alternative therapy, and there actually weren't many disease-modifying therapies at that time. Once they came out, people would say, I'm afraid of those, I'm just going to try the bee sting therapy, even though their doctor would say, there's really not evidence for that. So that would be doing something in an alternative way. A complementary therapy would be a person who's following the recommendations of their medical doctor, their healthcare provider, and additionally seeing an acupuncturist, maybe a massage therapist, maybe taking safe supplements.
Okay, great. And are there more popular therapies today that people are using in the MS world that you see in your practice that seem to be very helpful versus others?
Yeah, I think, excuse me, I think one of the things that I really tend to hone in on is safety. And because of the internet and the things that we have access to, I feel like maybe twice a year there's this new wave of like the coolest thing on the internet that's going to heal your autoimmune disease. And so I have people approach me about different types of diets, like the ketogenic diet. I have people more recently coming to me about the lion's mane mushroom. Something that's been around for a long time is ashwagandha, which is an adaptogen. The problem with these things is that they really haven't been studied in an MS population, and specifically in a population of people living with a disease who's also on immune modulating or immunosuppressive therapies. And so we wonder, well, if you're giving someone a supplement, for example, ashwagandha, that's supposed to be really good for your immune system, well, if your immune system works wrong, then would giving you something that's supposed to be good for your immune system make it work wronger? Right. I don't know if there's the right word for that. But I think what people come to me with most often that's very helpful are manual therapies like massage therapy, physical therapy, which isn't necessarily alternative, mindfulness therapy, yoga, and of course CBD is a big deal, and that's kind of in the complementary and alternative realm. But then the question just becomes, is there evidence, and is this thing safe?
Yeah. So that makes me think about, like, say, ashwagandha. Say you're interested in doing something like that. How do you know which one is safe, where it's sourced? Is there any recommendations on? Yeah, so there's just to say right off the bat, there is no data that ashwagandha does anything in MS, and there is a warning that it actually might be harmful. But when you're looking for a supplement, you really have to be careful about where it's sourced. If it's coming from India, China, or Mexico, those are the supplements that tend to be most adulterated, either with toxic substances or even with medications. So, I always tell people to avoid getting their supplements on Amazon, even though it's cheaper. It's really easy to, get a white bottle and slap a label on it. And to use either professional grade supplements that your healthcare provider gives you not necessarily a prescription for, but
maybe a website to get them from, or consumer brands of professional grade supplements. You can look for things like the USP label, consumer labs. There's something called a gold seal, which also is really a high level designation of testing for quality and safety and consistency among supplements.
Yeah, it can be complicated.
Yeah, it is.
And also you mentioned some different diets. Any recommendations? I know every person is different or responds different, but in terms of living with MS?
Absolutely. So I don't think you have to follow a hardcore specific diet, that you have to read a book for or join a website for or something like that. The WALS protocol is probably the most popular diet for MS right now, and there actually is data that suggests, when it was studied, it's called a modified paleo diet, but suggests that there's an improvement in fatigue and depression and energy. Similarly, with the ketogenic diet, there's some preliminary evidence that it also improves fatigue and insulin sensitivity. And then the diet that I do tend to recommend the most is a plant-based Mediterranean type diet. And the reason is that this type of diet has been studied for 20 years, and it's been proven to be effective for cancer prevention, cardiovascular disease, prevention, and also amelioration of those symptoms. And it doesn't necessarily require you to eliminate food groups. I think what's most interesting about Mediterranean type diet is a high quality diet rich in these monounsaturated fatty acids was studied, and it showed that when people followed that type of diet, there's an increase in cortical thickness. So that might translate into something exciting down the road. But general rules I tell people to follow are: most of your plate is plants, vary your veggies, eat lots of bright colors, shop the perimeter of the grocery store, avoid processed foods, avoid sugar sweetened beverages, soda, and if you're buying packaged food, try to buy stuff that has less than 5 ingredients, and if you can't pronounce it, put it back on the shelf. The last little thing I'll say is that the World Health Organization has deemed that processed meats are grade 1 carcinogens, so of the same level of potential for harm as smoking, though not to the same degree. And that's hard because if you listen to a lot of these people following paleo and ketogenic diets, it's just an excuse to eat bacon and sausage. And that can be really harmful.
Wow.
So those are my nutrition
That's great information. Thank you for sharing that.
That and drink a lot of water. Stay hydrated.
Drink a lot of water. And what about movement? Can you just share with us? Obviously, we know there are benefits. Even when there's challenges, how can we incorporate movement?
Absolutely. So I've started to talk about exercise more as movement than exercise, because kind of like nutrition, if we talk about diet, there's automatically this like, oh, I got to go on a diet, I'm going to do it wrong. And same thing with exercise. Oh, it's got to hurt. I got to do it forever. That kind of thing. So I talk about just moving your body. And certainly when there are limitations, you have to kind of get over some of the exercise hang-ups. Like, it doesn't count unless I'm walking. It doesn't count unless I do it for a half hour. Well, if you can move your body for 10 minutes in a meaningful way, even if you're sitting in a chair doing some, arm exercises and leg exercises, if you're stretching, doing yoga, if you're doing Tai Chi standing or in a chair doing some balancing exercises, gardening, dancing, deciding to go outside to the mailbox instead of sitting inside, just moving your body. And if you can't, having someone actively move your body for you is helpful. And it just might look different than it used to. And of course it does for all of us as we get older. So I always encourage people to use the help of an exercise professional or a physical therapist to get going when things change with their bodies.
Great. Thank you. And share with us what you do, Megan, so that people understand how they can contact you directly, or also, what kind of work it is that
Sure. Yeah, thanks for asking. So I have a practice called First Coast Integrative Medicine, and I'm practicing neurology from an integrative perspective. So I still do conventional neurology with, MRIs and labs and prescriptions and what's your vitamin D level, but then I help people take a look at their nutrition and see what works best for them in their lives. I help people develop mindfulness plans with meditation and prayer, whatever, again, fits best into your spiritual belief system. I use supplements and botanicals if I've identified them to be safe based on your medical conditions and the medicines that you have to take. And I think the best thing for me is that I really spend a lot of time with people, and I just get to know them in a different way than I did in the traditional healthcare system.
The whole picture.
The whole picture, yeah.
Sounds wonderful.
Yeah.
Thank you so much for being
You're
with us.
welcome. Thanks.
Okay, everyone, we are back, and we hope you enjoyed that video as much as we enjoyed making it. And I want to welcome Dr. Megan on the line. Megan, are you there with us?
I am. There's some YouTube kids music in the background, but hopefully everybody can hear me okay.
Oh, yeah. It sounds great. We don't hear any YouTube kids music, but
Great.
we welcome it if it comes through. So thanks for being here with us tonight. Welcome.
Thanks for having me.
Absolutely. We have a lot of questions coming through, and I know I shared some with you in advance, but I'm going to start here. And I know you mentioned the Terry Wahls diet during your interview, and someone really is asking, what is your view on that? What's your perspective or feelings on the Terry Wahls diet?
Yeah, so I will be very truthful and say that when I first learned of the Terry Wahls diet, or the Wahls protocol, I was not a fan because I think that nutrition is a lot like politics, and there's the left and the right, and which is the equivalent of like plant-based on one side and keto on the other. Mediterranean's in the middle, and paleo somewhere towards keto. So I was under the impression that the Wahls protocol was a meat-based diet, and then I finally read the book, probably 10 years too late, and then I finally started listening to Terry Wahls. And when you listen to her, when you read the book, she actually states that you use meat as a condiment, and the basis of her diet and of the good things in her diet, I truly believe, come from the green leafy vegetables, the sulfur-rich vegetables. And while she does use meat and the organ meat specifically for the mitochondrial health, there are now ways to do that without eating meat themselves if you choose not to. And I think the other thing that's really important about the Wahls protocol is that people need to understand that at the highest level of the Wahls protocol is the quality of the food that you're eating. So if you cannot eat hormone-free, antibiotic-free, grass-fed, grass-finished beef, bison, game, that wild-caught fish, that type of thing, you really should choose a different protocol to follow, because eating 50 cents a pound ground beef from the grocery store is not going to give you the same benefit. It's actually probably going to cause harm. So when I talk to people about diet, I just really try to meet them where they are. We know there's benefit from the Wahls diet, like I talked about. There's benefit for fatigue. There's some benefit for, most of the benefit comes in fatigue. Some of it comes with mood. Hey, buddy, put that back in your bowl, please. And so if someone wants to follow it, I'm happy to guide them through it.
That's great. That's great. So just sticking with the Terry Wahls protocol right now, somebody else is asking, what do you say to MS patients with stable disease who want to discontinue their disease-modifying therapy and rely solely on the Wahls diet or any other diet?
So what I tell them is, hold on one second, I'm going to have to just ask my little guy here. Are you done with the noodles? Okay. There is absolutely no data to say that that's beneficial or that will keep their disease stable. We have currently with with the WALS protocol, with other, nutritional recommendations for multiple sclerosis, there is no data to suggest that they modify disease. And this was actually looked at a long time ago with diets that were high in omega-3s and with omega-3 fatty acid supplementation. Because, and I'm talking maybe 15 years ago, because there were some studies that suggested there may be relapse rate reduction with diets high in omega-3s. They just didn't pan out. What's happening right now with the WALS protocol, I'm trying to pull up, okay, buddy, there you go. I'm trying to pull up some references right now. What you need, and of course this is the problem, and a lot of the problem with integrative medicine is that what you need is a double-blind placebo-controlled study that looks at relapse rate reduction, MRI, and disability progression. And because the WALS protocol doesn't generate, millions of dollars, it's hard to get a study going for this and other diets. They tend to be smaller studies, and even if there are positive results, they're not replicated. So that's the long story to say that we just don't have data for that. Now, as a healthcare professional and someone who believes in shared decision-making, I would talk to you about what I know about disease-modifying therapy and what I know about nutrition for MS. And I would give you the best resources that you have to make your best decision. And I would, if I thought that you made the wrong decision, I would certainly continue to try to arm you with the best information to make the best decision for you. So I think that answers the question in a number of ways.
Yeah.
But I certainly would not recommend stopping disease-modifying therapy to go on a nutritional protocol that you think could potentially modify disease.
Okay, thank you. Thanks for answering that so nicely. Yeah. So staying with nutrition, we have another question. You mentioned plant-based diet and Mediterranean diet during your interview. Do you think it's best to remove fish also?
Do I think it's best to eat fish?
To remove fish from the diet.
Oh, to remove fish. So a Mediterranean type diet typically includes fatty fishes as their number one source of, quote, animal protein or omega-3s, even above poultry. So I don't recommend removing fish from the diet unless you can't get good fish. So if you can't afford or can't access, wild-caught salmon or appropriate types of what I call what are known as smash fish. So salmon, mackerel, anchovies, sardines, and herring. Those are like the top 5 best fish from an omega-3 standpoint. Then eating, pardon my French, but crappie fish 3 times a week to try to get fish in, just don't eat it. So tilapia, horrible. Tuna 3 times a week, it's super high in mercury, may not be the best thing to do. So I personally incorporate fish in my diet. I don't recommend removing it unless there's a problem with it. It's okay, buddy. Or unless you can't get good sourced fish.
Okay, great. Thank you. I'm going to shift because we have a lot of the COVID-19 questions. So we're going to shift towards that. So Megan, from an integrative medicine perspective, how is COVID-19 being addressed? And is there anything that can protect or help support the immune system?
So that's just such a great question right now. I have to say that studying COVID-19 has helped me immensely in understanding the immunology of MS. And I say that because this virus is a pretty nasty virus, and it definitely bears a second look. So there are many things that a person can do, and I would actually, I'm just going to give everyone this website because it's just full of great resources. So let me get there so I can give you the right one. If you go to https://integrativemedicine.arizona.edu. If you just, and that's the Andrew Weil Center for Integrative Medicine. If you go to that website, integrativemedicine.arizona.edu, on the top left side of the page is a tab that says COVID-19 resources. And these are resources not only for graduates of the fellowship, of which I'm one. Okay, buddy, we'll get your foot off, but also for the general public. They have excellent resources for integrative strategies, free well-being courses, and then there's an article that was published in a journal that basically looks at the best things you can do to prevent COVID-19. And unfortunately, really none of these measures have been validated in human trials as effective specifically for COVID-19, but because of what we know about how they work, we expect them to be as effective as we can get at prevention. And the first one, and I actually did a sleep talk today for the MS Foundation, for MS Focus. The first one is adequate sleep. So many of the things that people recommend for preventing infection are supplements that may not be safe for people living with MS. Adequate sleep is safe for everyone. So, and specifically this was studied in people developing the rhinovirus and then other markers of inflammation that COVID-19 can activate. So adequate sleep of at least 7 hours. Stress management, so another component of integrative medicine. So that includes, mindfulness, meditation, prayer, breathing exercises, guided imagery. Another one that is usually not harmful for people is zinc. Zinc in doses of 15 to 30 milligrams daily can inhibit viral attachment and replication. And hold on, buddy. Zinc can interfere with the absorption of copper. So I don't recommend that people take zinc for long periods of time. And I definitely recommend talking to your healthcare provider before you take it. Another thing that hurts no one is eating vegetables and fruits that are high in flavonoids. And so these are just, tomatoes, oranges, nuts, berries, drinking green tea, onions, apples, parsley, celery, turmeric, vitamin C, foods that have vitamin C. So I think these are the most common things that are relatively safe. Now in MS, we typically don't recommend extra doses of vitamin C. Over about 250 milligrams a day because of the theoretical effect that it could have on an immune system gone awry. And sometimes I'll recommend higher doses of vitamin C to people for short periods of time, like 2 weeks maybe, but COVID here, it's not going away. So what I tell people to do is really to just eat their vitamin C. The body responds well to eating food. So eat foods that are high in vitamin C. I think you might ask me a question about vitamin D and elderberry. Do you want me to just keep talking about those things?
Go for it.
Okay. So elderberry historically has been an excellent antiviral, and it could be effective in preventing getting the coronavirus. but it should be discontinued immediately if symptoms of the infection occur. And that's because of its effect on the immune system. You can now see how complex the immune system is. There are certain chemicals, chemical messengers, inflammatory components of the immune system that go bonkers when someone contracts COVID-19, and that's what causes the horrible pneumonia that kills people. And some of these, and that's the immune system trying to do its job, but it's doing too much. And some of these supplements actually can worsen that, and elderberry is one of them. So if you're taking elderberry, again, short periods of time to try and prevent the coronavirus, if you were to develop a symptom, you should stop it immediately. Absolutely no echinacea to try to even prevent the coronavirus. The other thing that has research in both directions, good and bad, is vitamin D. So vitamin D has been found to decrease the activation of this overactive inflammation in the coronavirus, but it also reduces this really important interleukin that can heal inflammation. So in a little bit, buddy. So there's a thought that, taking high dose vitamin C to prevent the coronavirus may be beneficial, and many people with MS are taking high dose vitamin C, so yay. But then there's a thought that if you develop symptoms of the infection, you should stop the vitamin D. And I think that's important for people with MS to know, because if you do develop COVID-19, symptoms of the infection or a positive test, stopping your high dose vitamin C for maybe 2 to 6 weeks is probably not going to be harmful for you and potentially could be beneficial. And again, that's all theoretical.
This is so important, though. I mean, this is many of the things that you're mentioning are things that people take or want to take or are interested. I mean, the elderberry, the echinacea. So to know that it could actually be harmful if you were to contract this virus is really interesting.
So I never recommend echinacea in MS unless it's maybe for I'm going to go on a plane, and I always get sick when I go on a plane, and I want to take, what is it called? Airborne. Okay, take it twice, whatever. But definitely, I do not recommend echinacea in this era. I think it's so important just to know all of the things that you can do that you could not possibly harm yourself with. And basically that's getting sleep, following a good diet, stress management. These things actually do have good data behind them. And the vitamin D thing, it's a big deal, right? So I wouldn't ever tell a person living with MS to stop their high dose vitamin C. But if you have the coronavirus, it may be worth. There's. Let me just put it this way. There's a recent study that came out that suggests you should continue it, and there's a recent study that came out that suggests you should stop it. So it's a coin flip, and you really should work with a very knowledgeable integrative health provider in conjunction with your medical doctor, your PA or NP, to decide what the best thing is to do.
That's great. And just to share with everyone, we have so many people, Megan, online tonight for you. But just to share, I did read the article at integrativemedicine.arizona.edu. And for everyone, I'm going to post that when we post this YouTube video. I'll put that as
thank
a slide.
you. Yeah, it is a great resource. Yeah, and they have really wonderful free wellness classes right now.
Yeah, I saw that too. So I'll definitely put that on. It's very easy to understand and really a wealth of information there. So let me see here. I've got so many questions for you, Megan. Let's see. Give me just a second. What are your thoughts, just a bit of a shift, but what are your thoughts about stopping a disease-modifying therapy at a certain age?
I think the jury's still out. So the DISCO MS trial, I think ends in 2022. I could be super off on that. I need to look it up while we're on the phone. But these are my personal thoughts, not based on any science. So everybody living with MS is different. And in fact, everyone living is different. So DISCO MS is going to provide us with some good data that looks at stopping disease-modifying therapy in people with stable MS above the age of 55, which is young. Like 55 is young. You know, I have people taking beta seron that are 72 and they've been on it for 35 years. Everyone, and I'm sure people on the line have listened to news shows where there's a chronological age and a biological age, right? And we talk about immunosenescence. So immunosenescence is this, it's not really a theory, it's true that the immune system kind of, I don't want to say it weakens because that's not a great way to say it, but it just doesn't have this heightened inflammatory response like it does when a person's younger. It's not as angry. I mean, hopefully that happens to our personalities too as we get older. You know, we kind of have like we're less angry about things. However, I know people in their 70s who are so healthy and so active that their biological age is probably younger than their chronological age. And those people typically have stable MS on disease-modifying therapy. And I worry that stopping their disease-modifying therapies could potentially leave an unprotected body that is still primed to mount a pretty strong inflammatory response because they're healthy. And then you take a person who's not healthy, they're of older age and they have diabetes and high cholesterol and high blood pressure and obesity and multiple sclerosis, and their body is kind of just living in this state of inflammation. And so taking them off their disease-modifying therapy may not be the best choice. So I think the trial is going to give us more information to make better decisions for people. But even when that trial result comes out, I would not use it as a blanket, oh, you're 62, we can stop your disease-modifying therapy. I think it really is a very individualized decision.
Okay, great, thank you. And I have a question from Tamara asking if you feel that people should be wearing when they go out.
Say that again. I missed the middle part.
Do you feel that people should be wearing masks as they go outside?
So I'm a masker, and I'm a mask wearer. I'm a mask wearer because I'm a healthcare provider, and that means that I see people who are of high-risk populations. I'm a mask wearer because I believe that, because my ethical belief is that I believe in the greater good. And so if I wear a mask and it makes a person pause and say, maybe I should be wearing a mask to protect my grandmother who I might want to see in a month, then I've done service to our humanity. I'm a mask wearer because it prevents me from touching my face. I'm a mask wearer because it, again, reminds other people about the importance of being careful. There is some data that suggests that, in a doctor's office, if the provider is wearing a mask, if one person in a doctor's visit is wearing a mask, there's a much less protection offered than if both people are. So, yes, I'm a mask wearer for now. I'm also of a family that practice significant social distancing, and only just recently have we started seeing friends, and only those who've been living like us and only 6 feet apart or more outside with masks. So that being said, I also understand the mental health part of all of this. And if I could offer one piece of positivity for mask wearing, is that in my opinion, it forces people to look each other in the eye. And now more than ever, it's important that we look each other in the eye.
Oh, that's true. I love that. Thank you, Megan. Thanks for sharing all of that with us. Yeah. Okay, great. We have a question from Kimberly. This is pretty specific, but I think it might be able to help others as well. Kimberly is telling us that she has a bulge and herniated disc for 11 years. It doesn't really bother her unless she throws out her back, but she was also diagnosed with MS 11 years ago, and there's lesions in that the same region as her disc damage, and she's asking, how can she tell which affects her mobility with her legs? Is it her back injury or her MS, or is there a way to?
Oh gosh, Kimberly, that's a really great question, and a very hard one to answer. So if you actually have lesions in your cauda equina, which is unusual in MS, but it happens, you know, typically lesions that affect the spinal column cause hyperreflexia. So like your reflexes are like overactive, and spasticity, whereas disc disease causes things like weakness that gets worse when you walk if it's causing compression of the spinal canal. Both disc disease and MS can cause numbness and tingling in the extremities, can cause weakness in the extremities. You know, if you get a good neurologist who can review your MRI with you and also have a good technical EMG nerve conduction study done, then you may be able to tease out some of the symptoms of what belongs to what with your neurologist.
Oh, that's great. That's amazing. Okay. Thank you.
You're welcome.
That's very helpful. Yeah. Alyssa is telling us that her MS was stable, and now she's having a serious flare with vision in one eye. She's on the Terry Wahls protocol. She's on medication, and she practices Tai Chi. And she wants to know if there's anything in functional medicine that can assist her at this point.
Yeah, so I'm a big believer in, lots of things. So when I see a person and I look at them from an integrative standpoint, I use functional medicine as a tool. And so part of that would be potentially checking labs to see if there's anything any nutrient or micronutrient deficiencies that could help with her symptoms, and any potential bugs that haven't been addressed that might be affecting her microbiome, that as a whole could potentially cause inflammation to be more rampant in her system, and that would involve a stool test. From an integrative standpoint, I'm a huge believer in mind, body, spirit work. And so from the standpoint of like, what else could you do to manage MS and potentially keep it at bay? I have a history questionnaire that's about 10 pages long that goes as far back as before you were born. To try to garner information from people about what could potentially have triggered illness and how we can prevent that from triggering more problems. So I do think that functional or integrative medicine could be beneficial.
That's amazing, Megan. And let me ask you, are you able to see patients right now? Are you able to practice telehealth or any kind of virtual?
Yeah, so my practice has always been set up for telemedicine. I'm licensed in look at that birdie. I'm licensed in Florida and Hawaii, so I can see people virtually who live in Florida and Hawaii. If a person that doesn't live in those states wants to see me, they have to come to Florida to see me to establish care. But I am set up to do telehealth. It works very well. I have clients from all over the state of Florida.
That's wonderful. Well,
yeah.
Thank you so much, Megan. And again, I'm going to be sharing that resource once we post this interview and this talk we had tonight, and we thank you for joining us tonight and sharing
Yeah,
this
absolutely.
amazing information. Yeah, absolutely.
Thanks so
Thanks
much.
so much. Thanks, Megan. And
You're welcome.
And in conclusion, tonight's webinar, as I was saying, and on the rest of our series is all going to be on our YouTube Learning channel. And once you visit the MS Views and News YouTube Learning channel, you can subscribe there and you'll receive alerts every time we post a new video of something like tonight. And all of you that are registered now, that are online tonight, are now registered for the whole series. So next month it will be held on July 7th, and the topic is mental health and wellness. And we're going to have a discussion on the prevalence of depression and anxiety and living in with MS and living in today's world. And we're going to be welcoming Dr. Rick Harris, who is a psychologist. And I think it'll be a great talk that we will all benefit from and we'll be able to really open up with. And after we're done, please look for a quick email. We're sending out an evaluation for all of you on this webinar tonight. We love hearing from you. We love hearing your feedback. We love hearing your ideas. And all of these programs are really based on what you all are looking to learn more about. So I read them all, and I help develop these programs. And if there's a topic or an idea that you have, please share it with us. We'd love to hear it. And we thank you for being on tonight, and we look forward to being on with you again soon. Okay, everyone, be well, and thank you so much.
Thanks for your hard work, Jen.
Thank you, Megan. We'll talk soon.
Good night. Bye-bye.